Hai, Assalamualaikum warahmatullahi wabarakatuh. My name is Siti Nur Zawanis. My number is 23DIB22L2023. With my partner is Muhammad Fakaruddin bin Omar. With number is 23DIB22L2013. So, today we want to describe or we want to explain our oral presentation with the title is COVID-19. So let's check it out. So guys, before we start, I want to ask you guys, what is COVID-19? COVID-19 pandemic, also known as the coronavirus pandemic, is a global pandemic of coronavirus disease 2019. This is caused by severe acute respiratory syndrome coronavirus 2 or SARS-CoV-2. The novel virus was first identified in an outbreak in the Chinese city of Wuhan in December 2019. So, I want to add a little bit information about what is COVID-19. As we know, COVID-19 is so dangerous to our health, to our body, especially for teenagers, to baby, to old men, to old women. So for that, we need to keep avoid from coronavirus. For example, we need to wear a face mask, we need to keep distancing to other people. So for that, we can keep our body healthy like before. So that's a little bit about COVID-19. Okay, so next we move to how does COVID-19 spread? We know that the disease is caused by the SARS-CoV-2 virus, which spread between people in several different ways. Current evidence suggests that the virus spread mainly between people who are in close contact with each other. For example, at a conversational distance. The virus can spread from an infected person's mouth or nose in small liquid particles when they cough, sneeze, speak, sing, or breathe. The next point is the virus can also spread in poorly ventilated and or crowded indoor setting where people tend to spend longer period of time. So, this is because aerosols can remain suspended in the air or travel farther than conversational distance. This is often called long-range aerosols or long-range airborne transmission. Next, people may also become infected when touching their eyes, nose, or mouth after touching surfaces or objects that have been contaminated by the virus.
Hi, I'm Fakaruddin. Next, let's talk about symptoms of COVID-19. As you know, COVID-19 is a contagious disease that is dangerous if a person does not take action. For your information, if a person has COVID-19, there are various symptoms that have been reported. It ranges from mild symptoms to a severe disease. Symptoms may appear from 2 days to 14 days after being exposed to the virus. Anyone can experience mild to severe symptoms. Among the symptoms, there are many symptoms such as a fever, cough, shortness of breath or difficult breathing, fatigue, muscles or body pain, headache, taste or smell, sore throat, and diarrhea. There are symptoms of COVID-19. If a person is either a family member or a friend experience these symptoms, they should be referred to the hospital as soon as possible. Thank you. You still here, guys? Next, I want to talk a little bit about a factor that raises your risk of getting very sick from a COVID-19. First is age. Older adults, especially those aged 15 years and older, with risk increasing with older age. It is more likely than younger people to get very sick if they get a COVID-19. This means they are more likely to need hospitalization, intensive care, or a ventilator to help them breathe. Most COVID-19 deaths occur in people older than 65. Next, a factor of risk to get a COVID-19 is an immune compromise or weakened immune system. It's having a weakened immune system, also known as being immune compromised, can make you more likely to get very sick if you get a COVID-19. People who are immune compromised or who are taking a medicine that weaken their immune system may not be protected as well as others, even if they are up to date on their vaccines. For this reason, it is important to have a COVID-19 plan to protect yourself from infection and prepare for what to do if you get sick. Last but not least is underlying health conditions. It is certain underlying health condition you have. For example, obesity or a chronic obstructive pulmonary disorder may affect your risk of becoming very sick if you get a COVID-19. Often, the more health conditions you have, the higher your risk. Certain conditions increase your risk more than others. For example, heart disease increase your risk more than higher blood pressure. Next, I want to share a little bit information about how to prepare and protect yourself from COVID-19. First thing first, you should wash your hands often with soap and water and regularly clean and disinfect a surface. Besides that, keep taking your normal medication and follow medical advice is also important. After that, adopt a healthy lifestyle to help your immune system, such as eat nutritious foods, get enough sleep, don't smoke, and active. Next, maintain a distance of at least 1 meter and avoid a physical contact with other people. After that, make sure you have at least a month's supply of medicines. In case you need to stay home, plan on how to get more in case you need to stay at home longer. Last but not least, if COVID-19 is spreading in your community, stay home as much as possible. Avoid going to church and other places with a lot of people. That is some of how to prevent COVID-19 from spreading. Thank you.
I want to conclude the 3 main points that we discussed before. First, we want to conclude that we need to take care of ourselves because COVID-19 is the most dangerous types of virus. For that, to protect ourselves from the COVID-19 virus, we need to wear face masks, keep social distancing, and don't go to crowded places. Hopefully, we can reduce the spread of the virus while treatment and vaccines are developed to stop it. So, do you hear that? So, let's do this.